Spoštovani in spoštovane, dober dan in lepo pozdravljeni na novinarski konferenci ob drugem simpoziju Alpe Adria, posvečenem novostim v diagnostiki in terapiji motenj gibanja. Ker gre za mednarodni dogodek, bom od zdaj naprej govorila v angleščini. So, welcome everybody to the event in which we are going to introduce the second Alpe Adria Symposium on movement disorders, presenting the updates in the field. Allow me to introduce the panel of distinguished speakers today. Professor Elena Moro, MD, PhD, neurologist. She is the president of the European Academy of Neurology, the director of the Movement Disorder Unit, and chair of Department of Psychiatry, Neurology, Neurological Rehabilitation and Forensic Medicine at the University Hospital Center of Grenoble, and also professor of neurology at the Grenoble Alpes University in France. Professor Kailash Bhatia is also a physician and fellow of the Royal College of Physicians and holds a doctorate in science. Professor Bhatia is a neurologist and president-elect of the European Academy of Neurology. He is affiliated with the National Hospital for Neurology and Neurosurgery in London and is a professor of clinical neurology at the Department of Clinical and Movement Neurosciences at the Institute of Neurology of the University College London in the United Kingdom. Associate Professor Maja Kojovic, MD, PhD, and neurologist, President of the Slovenian Neurological Society. She is affiliated with the Department of Neurology at the University Medical Center of Ljubljana and is an Associate Professor of Neurology at the Faculty of Medicine of the University of Ljubljana in Slovenia. Robert Reiner, Master of Science, nurse specialized in Parkinson's disease, is the head nurse of the Department of Neurology at the University Medical Center Ljubljana, and also head of the Neurology Nurses sections at the Nurses and Midwives Association of Slovenia. And last but not least, Professor Maja Trost, MD, PhD, neurologist, is the medical director of the Neurology Clinic and head of the Movement Disorder Center at the University Medical Center of Ljubljana. She is professor of neurology at the Faculty of Medicine at the University of Ljubljana in Slovenia. My name is Maja Bresjanac. I am a physician, basic neuroscientist, and a lecturer in pathophysiology at the Institute of Pathophysiology of the Faculty of Medicine of the University of Ljubljana. Let us dig in. The topic is movement disorders. And so I would like to invite Professor Trost to introduce us to the topic. What are the most common movement disorders and what are the underlying diseases causing them?
Thank you very much, Maya, and welcome to everybody also from my side. Movement disorders are a very broad term. Practically every part of neurological system, if damaged, can cause movement disorder. But neurologists use the term movement disorder usually for the problems with movement that are caused by some parts of the brain that are hidden deep within. We call them basal ganglia. And it will become probably more familiar to everybody if I will tell you that the most common movement disorder, the most common disease of basal ganglia is Parkinson's disease. Usually the people know that Parkinson's disease is the disease that causes tremor, and some people also know that it causes slowness of movement. But unfortunately, Parkinson's disease is much more than tremor and slowness. It causes many problems to the patient and also the caregivers. And I'm very glad that we are going to go through the updates of this disease in the next days here in Ljubljana with very distinguished speakers from all over Europe and broader. Parkinson's disease is not the only movement disorder. The most common, the much more common is actually tremor due to other cause, not Parkinson's disease, which is somehow lighter but still annoying problem. It's called, for example, the most common tremor is essential tremor, but there are other movement disorders that are probably less known to the public. So people can have problems with coordination, with gait. Some may experience some involuntary movement. And this will all be the topics of the coming conference.
Thank you very much. Professor Kojovic, could I, in your role of the President of the Slovenian Neurological Society, invite you to share with us the current overview of the state and treatment of patients with movement disorders in Slovenia, what treatments are available to the patients, and what perhaps is the vision of possible improvements that you can share with us.
Thank you. In Slovenia, we offer patients with movement disorders the full range of available pharmacological treatments. In patients with advanced Parkinson's disease, both levodopa-based intestinal infusion pumps have been available shortly after their introduction in Europe, and since last year also subcutaneous pump has been available. At the moment we have 53 active patients on subcutaneous pump, and there is virtually no waiting time for initiation of pump treatment. We offer patients with Parkinson's disease, essential tremor and dystonia surgical treatment with deep brain stimulation. In the early years, we referred the patient to Munich, but since 2014, DBS is available in Ljubljana, Slovenia. We operate on average 2 patients per month, and this capacity largely depends on the neurosurgical availability. The waiting time for surgery is between 18 and 24 months. However, even though that we are quite advanced in treatment options, we also face some very basic challenges. The issue number one is the long waiting time for outpatient visits. For example, in our movement disorder center, the waiting time for a first visit is 6 months, for follow-up appointment 12 to 22 months, depending on the clinician. And as a comparison, in Graz, Austria, the waiting time is 3 months only. For re-injection of botulinum toxin injection, the waiting time is 5 to 6 months, which is longer than its therapeutic effect. So the other important issue we have is with neurorehabilitation capacities, and we all know how rehabilitation is important for care of Parkinson's disease patients. I would like to emphasize that the problem with long waiting time is due to a shortage of neurologists in Slovenia. So Slovenia is below European average in the number of neurologists per capita, and if we compare it to neighboring countries, Italy and Hungary has twice as many neurologists per capita than Slovenia, and Austria and Croatia have also considerably more. As for the rehabilitation, again a comparison, in Austria, patients with Parkinson's disease are offered inpatient rehabilitation on a yearly basis or every other year, while our patients might not have that opportunity even once, let alone every year. So the main problem is the lack of rehabilitation centers that are specialized in Parkinson's disease, and also our insurance does not cover this service on a regular basis. So to cut this long story short, yes, we do have cutting-edge treatments that are comparable to the best centers in Europe, but overall care of patients might be weakened by limited workforce, and it's not only neurologists, but also nurses, physio, occupational therapists, speech therapists, dietitians, and lack of treatment facilities. In this area, we need policy interventions to achieve improvements, such as building new treatment facilities and providing funding for education and employment of new staff.
Thank you very much. After this brief introduction into the current state of movement disorder diagnosis and treatment options in Slovenia, I would invite Professor Moro to maybe take a look at a wider frame and give us an appraisal of the state and challenges of the movement disorders in Europe.
Thank you very much, Maya. I really would like to give you some numbers of which help you to understand the relevance of this Congress, of this meeting that has been organized in Slovenia. So the European Academy of Neurology collects 48 national neurological societies in Europe, which means around 45,000 neurologists, even if the neurologists in Europe are more. And what we are doing now is to collecting the impact, the cost of the top 10 neurological disorders in Europe and the burden. So I cannot give you the numbers now because we are publishing these papers, but I give you the numbers of coming from a recent paper published 1 week ago concerning US. So you understand the problem because it's very similar to us. So in US, we have 330 million of people like Europe. And what this paper says, that half of the population in US has a neurological disorder. And if you read from this paper, 660,000 people have Parkinson's disease, which is huge, which means that in Europe we have roughly the same. In Slovenia, you are 2 million, so it's a little more than 2 million, so you calculate. And what it comes from this paper is that the prevalence of Parkinson is increasing. So with the problem of the workforce, we don't have too many neurologists, we don't have healthcare providers, we don't have nurses, and there is the increased number of people developing neurological disorder and neurodegenerative disorders like Parkinson's disease. So this is a big problem. Then as you compare, in Europe, we said 48 different countries, bigger. You mentioned the shortage of neurologists in Slovenia. In Germany, there are 11,000, much more than other countries. So the access to care of people in Germany is different compared to other. In France, it's not better than Slovenia, I have to say. I'm working in France. So there is a lot of diversity in terms of care providers, and of course in terms of access to care. You were mentioning medication and treatment. I was in the Baltic Congress and we discovered that in Latvia, they don't have access to pumps. They don't have access to the brain stimulation. So even in Europe, there is a huge diversity in having a good care of your disease when it is in the advanced stage. In France, we don't have the same medication that you have in Italy, for example. There's some medication that has not been approved to be reimbursed. You can find them, but you have to pay one eye of you to pay them. So this is, we are facing, right, a bigger diversity in access to care and workforce load. So what we want really to do is to call all the community to have equity right? So we are Europeans, we have several rights, but we should also have the rights to be treated with equity in our region, right? And I think this is very important, and one of the role of our society is in Brussels to advocate, to meet the Ministry of Health, and not only health, to have a direct relationship with the national society, the president, to help, to have the same language and to work together for the rights of the citizens in Europe to be treated equally. So this, I think, is very important for Europeans to be together and ask for these rights for everybody.
Thank you. I think we wholeheartedly agree on that, but maybe Professor Bhatia would like to add his perspective.
Thank you. I completely agree with Elena. This is a big challenge for us. And I think what we got to understand is that many of these conditions are relevant to age. And in Europe, we have an aging population in most countries. And neurodegenerative conditions such as Parkinson's and others increase with the age. So we're going to be left with an even bigger number of patients with movement disorders such as Parkinson's in the coming years. And we have to already heard the challenges for us is we already lack the manpower. We do not have enough neurologists. A lot of people are not going into academic neurology. So that's a challenge. We got to make neurology more attractive again. The other thing is that now that we are getting advanced therapies, which are expensive, and more advanced therapies are coming in, which are even more expensive. And the delivery of those advanced therapies, you need specialists. So we have an increasing burden to be facing with neurodegenerative disorders. We have the challenges of attracting people into neurology, experts in those particular areas to be able to deliver these advanced therapies. And I think these are the challenges we got to do apart from the diversity which we mentioned, trying to bring equality into Europe. So these are major challenges, and we got to start now to be able to face this for the future, which is coming very soon.
Indeed, we are speeding toward the unknown future that holds many challenges. Going back to our situation in Slovenia and addressing the needs of the patient population, would it be possible to maybe open up the topic of the importance of multidisciplinary teams and what directions the development on that should go in? Please, Professor Trost.
Thank you. As I mentioned earlier, for example, Parkinson's disease, which is the most common movement disorder disease, doesn't affect only patients' movement, but it has many other dimensions. For example, many patients with years lose ability to think. They have problems with concentration, memory, and finally many become demented. They have a lot of problems with autonomic nervous system, as we say. That means that they are constipated even before they started to shake or being slow. They have fluctuations in blood pressure. They may have pain. Many patients are having mood problems, so they mean that they're anxious. They have loss of interest for the environment. They are apathetic, even depressed. So to be able to improve quality of life of Parkinson's disease patient, we would have to involve many specialists. Neurologist is not enough. Neurologist, of course, talks to the patient, makes a diagnosis, prescribe medication. But then the patient is still left with many problems, many fears, many obstacles, including caregiver, who cannot be addressed by neurologists, not only because we are not enough, but also because we don't have a special knowledge that patient needs. Nowadays, we are very much aware how, for example, regular exercise help. It's probably the only proven thing that has a good effect on slowness, on slowing the disease progression. But somebody who has never done any exercise and is diagnosed with Parkinson's at 60s, that would mean a huge change of habits. So this person needs a specialist, not neurologist, specialist physiotherapist to tell him or her how, at the beginning of Parkinson's disease, should start doing exercise, what type of exercise, how much exercise. It's not enough that they would just enroll into a gym or Pilates or whatever. It may be good, but it may not be. The patients, because of Parkinson's disease, have some problems in many everyday life activities. And for that, occupational therapist is a crucial person who can help them. Even more later, when the disease progresses, they become even slower, their movement is not exact, they have difficulty, for example, to putting on socks or a coat. But there are tricks, which is not tricks, it's a knowledge how to overcome these problems. An occupational therapist is very, very important to lead patients through his or her everyday life activities and help where it's needed to improve quality of life, again, of patients, but not only of patients, of a caregiver as well. Then, as I mentioned, many patients have problems with mood, they're anxious. Some need psychiatrists or psychologists to help them overcome the issues. Patients slowly lose weight, for example. They have a lot of energy consumption because they are rigid, because they shake, so they have to change their diet. I, as a neurologist, don't know what to suggest them, so dietitian is a crucial person of the multidisciplinary team. And it's also very important that these specialists that I mentioned, they don't see and talk to the patient individually, just physiotherapist and the patient, and then after 2 days, occupational therapist of the patient, and then psychiatrist, and so on. It's very important that all these team people sit together around one table and discuss together one patient and his or her needs. And I'm very, very happy and lucky that I work in the environment where the team approach towards Parkinson's disease patients is a tradition. The tradition was actually brought by the founder of our multidisciplinary team, Professor Zvezdan Pertušek, who brought this idea from UK, where he was working for many years. And for decades, we meet weekly, the whole team that I mentioned, and we discuss patients and how to help them from various angles. Because of the problems that you heard earlier, unfortunately, not every Parkinson's disease patient has this team evaluation. We can offer that to patients who are in the hospital, and patients with Parkinson's disease, unfortunately or luckily, are rarely in the hospital. We manage them in an outpatient basis, but on outpatient basis, we cannot offer team approach to everybody. A great help is the Society of Patients with Parkinson's disease, so-called Trepetlika, and they organize a lot of activities. But I think it would be right to be able to offer the multidisciplinary team approach to every patient from day one when he or she is diagnosed. Not that the problems with movement are huge then, but the burden of the disease is huge then, and the patient would need somebody else, not just 30 minutes talk with a neurologist. I didn't mention intentionally yet a huge importance of specialized Parkinson's disease nurse, and I'm very happy that Robert Reiner is here with us today, who is the head PD nurse in our team. I think PD nurse is like a mother, as a second mother to a patient. Patients are much more relaxed. They tell many more things to the nurse. And one of the importance of this multidisciplinary team meetings is that we hear from each other. Sometimes neurologists are surprised what information bring us either nurse or even physiotherapist or occupational therapist. They talk to these team members much more openly and relaxed, but they bring very important information. Even Professor Kojevic mentioned that we are very lucky in Slovenia that we can offer our patients all the so-called advanced treatments. These are pumps and deep brain stimulation. And for the follow-up of patients on these treatments, nurse is of utmost importance, because for every little problem, and patients have many little problems, they call nurse, the nurse calms them down, give the advice. So I'm actually very grateful that I can work in the environment where this multidisciplinary team works, but we would like to offer this care for much more patients that we are able today.
Thank you very much for this comprehensive explanation of the importance of the, I would say, not just multidisciplinary approach, but interdisciplinary collaboration in treatment of patients with movement disorders. But let us now hear from the very precious participant in that theme. So, Mr. Reiner, would you like to add?
Yeah, first of all, big welcome to everyone. As you could heard and you can see, a Parkinson's disease nurse can be also a very caring father as well. So in advanced Parkinson's disease, as we heard, it becomes clear very quickly that treatment cannot rely only on medication. Patient and families need education, reassurance, emotional support, and clinical guidance. And this is exactly why the specialized Parkinson's disease nurse is the backbone of the entire care and treatment pathway. Nurses enter the patient and family lives at the very start establishing of the diagnosis and remain with them throughout the whole treatment journey. Slovenia has more than 30 years of tradition with specialized Parkinson's disease nurse, and our team in Neurology Clinic in Ljubljana has recently expanded from 2 PD nurses to even 7 PD nurses, which we are very proud and lucky to have. This is a major achievement that directly improves the lives of hundreds of patients in Slovenia. But to fully meet the needs of those treated with advanced aided therapies. I want to also highlight that we have a long-standing tradition of highly skilled, high school educated nurses who are exceptionally well trained in the care of patients with movement disorders on the clinical wards. Their expertise is a core component of successful neurological care and treatment of every patient who also enters the clinical wards, because they remain with them 24 hours. We would urgently need as well so-called patient support programs in Slovenia, although we already provide many of these services informally, from continuous availability, phone assistance via PD nurse, to practical follow-up. They are formally funded or systematically supported. They are still not formally funded or systematically supported in Slovenia. Yet they remain a crucial pillar of safety and stability for patients and their families.
Thank you very much for that contribution. Let us then go again toward the future, and maybe again start with a wider picture. If I may, Professor Moro and then Professor Bhatia, could you let us know a little bit about your vision for that future, which brings a lot of challenges in the sphere of neurological disorders, in particular neurodegenerative diseases and specifically movement disorders maybe. If I may just add my own personal question, because it's a pet hobby of mine, how do you perhaps envisage the role of preventive neurology?
So you have a complex double question. So first, after what we said together since the beginning, so we are living in a very complex and challenging situation. So what, as the European Academy of Neurology, as we have thought to do, is to pin down the 7 major challenges for neurology in Europe that we have to face within the next 10 years, which is what we said: shortage of neurologists, increasing number of people having neurological disorders, cost of medication, neurointervention and migration, prevention, as you said, the brain health mission, the brain health concept that have to be understood by neurologists and by people living with neurological disorder, and even people, healthy people, and others, that we want to discuss together with the president of the Neurological Society to think globally and to act locally because of the diversity that we discussed before. So this is what we are doing now to help really to solve this issue and the future, to shape the future, because it's changing every year. You know, every day is something that we have to deal and adapt. So we are adapting neurologists. We are flexible, and I think this is very important. And also, if I may, we have to think about education, research in Europe, because all the innovation is coming from research, for thinking together. And I think as European, we have, and the neurologists, we have worked quite a lot to have the brain health partnership. So Europe has put 450 million euros for research in brain. And the calls are coming now in the horizon. So it's helping us also to shape the future, also in movement disorder, because the neurodegenerative are the one going up. And we discussed, about the increasing number of Parkinson. This is important that we are ready to this. And and you said, the prevention part, because we will never be able, 45,000, 80,000 neurologists, to face this increasing number of people, let's say probably 150 million people with a neurological disorder in Europe. Impossible. Mm-hmm. So the prevention is being called by the WHO to implement the IGAP. IGAP is the Intersectorial Global Action Plan for Epilepsy and Neurological Disorders. Each country should develop a plan to prevent, to optimize the treatment of people living with neurological disorder in every country. So this is, I don't know in Slovenia how you are with this, but all the Ministry of Health should be preparing and implement this plan. And as a neurologist, but not only as a neurologist, everybody involved in brain and neurodegenerative disorders should really be in this call and apply to do that. So this is a lot of work to do, but the advantage that we are talking now, and we realize that this is what we have to be done. We have already some countries that have advanced in this brain health mission, brain health implementation, and we want to share together what has been done from other people and what can be done in the single countries, in fact, to face these challenges that we have discussed.
If I just may, before I invite you, Professor Bhatia, I would like to thank you very much for pointing this out, because in Slovenia, we have been attempting to bring up this subject for a few years now, since the IGAP of the WHO was first brought up, and we have not been successful in reaching consensus on the need of a national plan for brain health and prevention of neurological disorders. However, maybe the sun is coming out because obviously
help us.
right now we are talking about this, and definitely in September, our Ministry of Health had officially signed a joining to the European Partnership, Brain Health Partnership. So perhaps within the next 7 years, and with our alignment.
Help. And
Joint help, yes.
if I add one important thing, just to understand the big picture. So the European Academy of Neurology is part of the European Brain Council. The European Brain Council represents the brain in Brussels, with the psychiatry, with the patients' association, that are very important, with the neurosurgeons, with the pediatrician, child pediatrician, and with the scientists, the neuroscientists. So we try really to call at the level of the European Parliament to have everybody in the loop, and also we were in New York to the National Assembly to talk about the brain. So, and we know that they are discussing really to have the brain disease, the brain health in the mission of each Ministry of Health agenda. So we are really trying to push for this. And I think with the help that we had in Europe with this national society calling together, I think slowly we'll get it.
Hopefully. So, President-elect?
Thank you. Yeah, I think, as Elena has pointed out, we have really big challenges. I just want to make just 3 points about this, what we've already alluded to. Like Elena said, one of the important things is that you should know the problem before you can start planning for that. And already we have taken steps in that regard, trying to find out which are the major issues which we need to be addressing. The second point, I think, which you rightly brought up, and which is the most important point, is prevention. And I think we got to start early in that regard, and even at the school level.
Yes.
And trying to bring into attention to the society that brain health is very important, and you can do something about brain health even now. So making sure that, making sure to the politicians, etc., good air, less pollution, starting exercise early, preventing trauma to the brain. So even, you might think about trauma which happens in rugby or in schools, etc. This may have impact later in life. Good food, good sleep. These 3 or 4 or 5 points, you can start now. And if we can bring this to the attention of the authorities in individual areas, and, like Elena mentioned, some countries have already started this. So Austria, for example, has a program in children, making children aware of your brain, and saying, this is your brain, how are you going to protect it? So the prevention aspect is not just at the policy level. It can obviously be very important at the policy level, but it should come into society, that the idea that you can do something about your brain right now to prevent getting neurodegenerative diseases in the future. The cardiologists have been very successful, and I think the neurologists have to follow in the same way to make this successful as a program. And people have to get engaged to understand why is it important that, so it's probably too late when you do develop the disease. You can do something about it now. And this, I think, if we can get that into the mind of the population, of the lay neurologists, we are talking about experts, but we want to bring this message to the lay neurologists to be able to tell them, you need to tell your patients, not just the patients, but even to the lay society, that these are very important aspects, and you can start now. And then finally, of course, the third point was about the inequity which we see. So these would be the 3 planks, I think, which I would be working on when I take over from Elena next year. Prevention, prevention, prevention. Brain, your brain, you have only one, and you've got to look after that.
Fantastic. In some small steps within Slovenia, we have started doing the little that we can as scientists and clinicians going into primary schools and kindergartens and starting to talk to children and their teachers and their parents and grandparents about this amazing organ that is contributing to the uniqueness of every one of us, and that can, if taken care of properly, serve us phenomenally throughout life on the individual level, but also we need healthy brains to build the society of the future. So,
I think it's a problem of public health. And this is the reason why neurologists have to be more involved in public health, because we thought in public health, what is this, right? And actually, this is in the same way that the kids, they've been taught how to brush their teeth when they're at school. The public health is the most important. So why the school? Because it's easy that they get this lifestyle since the beginning. As you mentioned, when you are older, it's difficult to change, right? And so if they can learn since when they are very little to preserve their brain as much as they can, is really a change in the society, right? We saw that in Alzheimer, we can prevent 40% of Alzheimer's disease. Right? But we have to start earlier, otherwise it's too late. And that is the thing, right? Yes. So we can really, with public health, we can change the society.
Even secondary prevention obviously works, because even if you start rather late, but then adhere, right, you can achieve a lot. But starting early would definitely pay dividends later on. I do have a script to stick to. So allow me to go on in the direction of maybe Professor Kojovic, if you can help us position teaching and research activities and ways in which collaborations within Slovenia and abroad can help us do a better job in the future.
We all agree that teaching and research is very important, and in these two areas, I think we could be proud of our achievements or our efforts. We make efforts to transfer the clinical movement disorder skills to younger generation through daily bedside teaching, the movement disorder meetings that Professor Trost mentioned with case discussion and clinical conferences. Also, the website of Slovenian Neurological Society continuously provides educational material. We also encourage young residents to complete part of their training abroad in knowledge centers, and also by applying to the fellowships that are offered by a European Academy of Neurology. In Slovenia, we are also active in research. We are mainly focusing on neurophysiology and functional brain imaging in movement disorders. So, for example, our department has a dedicated neurophysiology lab where we perform electrophysiology and gait studies, while functional brain imaging studies are performed with close collaboration with the Institute of Nuclear Medicine. We collaborate with domestic centers and also with institutions abroad. For example, neuroimaging studies have the team has a long tradition in collaborating with Feinstein Institute in New York.
Great. Professor Bhatia, how do you see the role of a clinician in this era of artificial intelligence and technological advancements?
So there's a lot of debate about this. So one thing to sort of put into context, on one hand, one end of the spectrum, we were talking about public health and prevention, etc. But the field has been advancing dramatically with regard biomarkers, for example. So, we have sometimes difficulty in distinguishing what looks to us as Parkinson's disease, but it may be a different type of Parkinson's, which we call atypical Parkinson's, and the prognosis in that and the response to treatment in those conditions may be different or not as good as what you see in simple Parkinson's. And people are now going to be relying more and more on biomarkers to make diagnosis. And also, as you said, artificial intelligence would be coming in, etc. And some people have started asking, how does the clinician fit into this new era of modernization which is coming in? And I think still the clinician remains the pivot around which we can use these advances to be able to help make the diagnosis. I don't think that at the moment the clinician can be replaced completely, but we have to be ready for the changes which are coming in, and the clinicians have to utilize these advances to be able to make better diagnosis, to be able to plan better treatment paradigms using. So what is happening is that we are using these large data sets. So when you're talking about artificial intelligence, large data sets which may be predictive. So which of these patients are going to develop, for example, dementia? So we know they have Parkinson's, subgroup of them will develop dementia. Can we prevent that? Can we predict in advance? So large data sets using AI already happening, that they may be useful in this context. The other thing I think where you can use the modern means is telehealth. We already talked about that we have a shortage of experts. And perhaps this is one place where you can have telemedicine come in. We used it in the COVID time, okay? But if we had a European framework where we say there is an expert on atypical Parkinson's or one particular form of Parkinson's in one particular country, and you can then have a sort of a resource of experts in different countries where people can, doesn't matter where you are, whether you're in Serbia, whether you're in Slovenia, wherever you are, you can form some sort of a program where telehealth or telemedicine can be used so that you can get expertise from experts all over Europe or even abroad, further than that. So I think there are challenges which are coming up because of these biomarkers and also because of the advances, but there are also opportunities. And I think the trick is to find the best way to use the opportunities so that we are able to help our patients better, using these artificial intelligence and these large data sets.
So the opportunities abound, but many of these challenges facing us will require investments. And maybe, Professor Moro, would you like to address the challenge of investing sufficiently in future research and development of these solutions to be made available to the public?
Yeah, what I mentioned before, that we have been advocating at European Parliament level for more money in research and more attention to neurological disorders, because in Europe the cost of neurological disorders is around 3 trillion euros a year, which is the highest cost of all the diseases, is more than cancer, and neurological disorders are the second cause of death in Europe. So, which means we try to make
disease patients, the majority of them have sleep problems. Tomorrow, almost the whole day will be dedicated to various types of treatments of Parkinson's disease, from early stages, mid stages to advanced stages. And as it was said already today, in Slovenia we are very lucky and grateful that we can offer our patients all the treatments that are available on the world, actually. And then the last part of the symposium would be dedicated to some diagnostic procedure. I think Parkinson's disease is one of the rare disorders which is still, although the development of technology is very advanced, it's still a clinical. But still, in some cases, the investigations can help clinician, and this will be covered on the tomorrow evening and Saturday. These only are the main topics. Of course, there will be some other smaller topics included. We will also have a couple of satellite symposia that were brought to the program by our sponsors, without whom you may imagine this symposium will not be possible. But we are very proud and happy that we added as a Slovenia and our program to the program dedicated to Parkinson's disease nurses, because I already mentioned that the role of nurses is huge in Parkinson's disease, and I would like Robert Reiner to present shortly this program for nurses.
Yeah, first of all, thank you, the committee, board, and you, Professor Trost, for recognizing the importance of this parallel session for nursing program. We will cover a few essential topics: recognizing symptoms, continuous therapies, patient and caregiver education, and preventing complication and supporting families emotionally. The program is designed not only for learning, but also for connecting nurses across the Alpe Adria region to exchange skills, knowledge, and all the practicalities which are hidden within the countries. So thank you once again.
If I may add, on the second day, in the afternoon, there will be a 2-hour or so program dedicated to younger colleagues, residents, young neurologists, who will have their session to present their research work. So we are looking very much forward
to see that all the youngsters will be presenting their research work. That's great.
Thank you.
Thank you for the presentation of the program. I did say before small steps, but it's actually quite a large step and in definitely the right direction to address the challenges that movement disorders and neurological diseases are bringing to us. I think we ought to conclude. Perhaps I would just invite our guests to maybe give us a short impression of Slovenia before we close for sure. Elena? Yeah?
I think I'm impressed. I want to congratulate with you for organizing this, as I said, very important Congress symposium and the work that we have done together for several years. And I'm looking forward really to work with you. We have this enhancing neurology project in Europe, and I think Slovenia can really be relevant and share the progresses and teach and learn also together then and so on with the other nations. So congratulations and keep going, keep going. Thank you very much.
Thank you.
I think that Slovenia is a success story. That's how I see it. It's fantastic that you are really at the cutting edge in many, many ways with the top of Europe, I would say. But also more important for me is this really nice camaraderie which I'm seeing here between the clinicians, the nurses, the younger generation which is coming up with the neuroscience. This is what I think this is a model example. This is what I wish was possible in every country, rather than people working in silos in individuals. As individuals, you can see here a wonderful cooperation between the different, I would say, limbs of the body of neurology, which is here. That's really wonderful to see, and I wish that this could be emulated everywhere else, like what Slovenia is doing. I have personally a lot of contact with Slovenia. Maja Kočević was my fellow for 3 years. Vesna, who's one of the young presenters, is also presenting. And I think Slovenia also is a beautiful country. So congratulations to the neurology fraternity for doing so well.
Thank you very much. And on this positive note, I think we can conclude this press conference. I think there is an opportunity to ask questions following the conclusion.
There is one question by email.
Mhm.
So the question is, how is the treatment of patients with movement disorders carried out at the primary level in Slovenia, as there are actually no support teams on the primary level?
So if I may repeat the question, so how is the primary care organized in Slovenia for movement disorders?
Yes, on the primary level, yes.
Mm-hmm. Usually, primary level is extremely important, actually, because this is the first door to the medical system, and general practitioners are those who recognize the need for referral to a neurologist. But neurologist sees the patient usually once a year, for example, a typical patient with Parkinson's disease, and the rest, many 364 days, the patient is left to the care of a general practitioner, who is a very, very important partner to the neurologist. The neurologist one of our many activities is also educating our colleagues, secondary neurologists, and also general practitioners. I'm sure more would be needed, but we are aware of that, and we try to do our best also in that field. I'm not sure whether I answered the question, but
Yes.
But yes, we are aware of the importance of tight connection with primary physicians who see patients regularly.
Hello, everybody. I'm Urša Blec. I come from Medicina Danes. I would like to ask a question to Professor Trost. You said before that a multidisciplinary approach is very important, and that you would like to offer it to all the patients. So it's actually a similar question, because how can you offer this approach on primary level? Through the healthcare centers, maybe, because they already have teams there with the different specialists. Is this a way forward? And also, I would like to know how this is implemented through Europe. I mean, in other countries, do we have a good example somewhere?
Yeah, that is a challenge in Slovenia. What we are trying to do is that somehow our mission in the field of neurorehabilitation, because of the great importance of physiotherapy and movement for patients with movement disorders, we would like to offer all the patients this neurorehabilitation on the regional level within the institution where their general practitioner is, zdravstveni dom in Slovenian. So many zdravstveni doms have the physiotherapist, and we would like that our PD patients would not only go to the spa care once every 2 years, but that they would have a daily or weekly access to the physiotherapist to lead their progress in movement and adjust it to the needs. This is not just a question for a neurological question, but it's also the question of the policy of healthcare in Slovenia. So we are trying that. We are in touch also the specialists for rehabilitation medicine. I mean, for the last 2 years, we are very happy that through the Society for Patients, the patient can have a group therapy in one of the Slovenian spa centers, but it is a group therapy, it's not so individualized. We would like to do it more personally within the location of where patients live, so they will not have to travel they have to travel to spa once a year for 2 hours, but they could have an easy access within a couple of minutes. But that is something that is our goal, but it needs to involve many levels of organization of health system. But we are going to this direction.
If I may, it depends where you live, right? For example, in France, there is a national plan. So the government has put a lot of money for the French population and the French neurologists. So we have a center of excellence. There are 12 centers of excellence where is a tertiary center where we do advanced treatment. Then there are secondary, which are usually the general neurologists, and the primary care that you said. So for doing that, also you need to the education. You have to teach at medical school level, do residency, and to follow with continuous medical education the physician and the nurses, because also there are programs for the nurses. And also you need to implement a patients association. So we always forget the patients, but the patients are the most listened people at the Ministry of Health level because they vote, whatever. And I think we have to really work together with the patients to be heard and to have a good care in each country. Otherwise, it's very difficult that we are just listen because we say we need more money and investment. And this is also a secret. So France got this because France Parkinson was very strong, and the same with multiple sclerosis and with Alzheimer. So we get this kind of funds directly from the government.
May I, maybe perhaps again, very similar setup in the UK. And one success story in this regard has been the Netherlands, where they have this ParkNet, which is of a network of physiotherapists. And it's very difficult for us to emulate the same, but one of the things which I think Elena has alluded to is the education. So train and return is a motto which we want to try and follow in the UK. So you bring these people from their primary centers, you train them, spend some time in the specialist center, and then return them back to their prime centers. And then we also have outreach programs. So these are people who are based in tertiary or secondary centers, but then who are sent out as what we call an outreach to go and then speak with or deal with the local physiotherapists or so on. You know, it's not just the physiotherapists, so community health and mental health as part of the program as well. So a number of issues, and we are all facing the same thing. The key problem is that the number of physiotherapists trained in Parkinson's is very few. And this is the problem. It's just not the specialists who are doing with advanced therapies. We need to have a larger pool of physiotherapists and others in Europe trained for these specialist conditions and who are then willing to go out and work in the primary centers. So it's a challenge, but that's what we do, train and return, outreach programs, and educating, like you said, CME and other ways, the physiotherapists, then they can go back to their communities and serve.
Just one question, please. Agnes Schweiger, Medicina. And then for how many years you have found to do that? Because
Years, sorry?
Wonderful.
How many?
You understand?
How many years does it?
How many years do you have money found, financial funds, to do that?
Not enough. No, we don't have money. But this is what we are trying to, you know, through the Parkinson's UK Society and so on, trying to get this awareness that this is the most important, one of the most important key areas for therapy. It's not just the drugs, but, the physiotherapy, the ancillary treatments, as we say, which is required. And we certainly, that's exactly the point, we don't have enough. And we need to somehow make this attractive. We have to ask the question, why are not enough people going into physiotherapy? Why are we not getting enough people training in neurology and in Parkinson's? Why? We don't know. And this is, maybe they just don't know. Maybe we need to educate people that this is a fruitful area, an area which will give you gratification. And it's not just always a question of money. People need to see that there is gratification in giving this service. And if that can come into the community, then more people might take up these positions as nurses, as specialists. We don't have enough specialist nurses, for example. We don't have enough physiotherapists. Yeah.
I have another question, if I may, about prevention. You said before, and we know that prevention has a big role in neurological disorders in general. What role does it have, especially in Parkinson's disease? Is it so? I don't know. We know in Alzheimer, we know we can prevent a lot of it with prevention. But is it the same with?
It's the same. I mentioned that already. So I have an acronym for it. I called it SEAS, S-E-A-S. So sleep, avoid injury, exercise, social interaction. So, as people are getting older, we don't have social interaction. So these 3 or 4 or 5 things are very important for you. And of course, good air quality. So that's why SEAS. So sleep well, avoid injury, good, no pollution, things like that. Those are sort of important aspects. But this has to be implemented. It has to be implemented, not just talked about. And that's why we talked about going down to the school level and starting there, preventing injuries right from then, sleeping well from then, eating well, less pollution, social needs. As we get older, people are becoming lonely. And everything is showing us that having social interaction, joining a group, something, families have become smaller, not enough interaction between people. That's very important, social interaction.
There are also some comorbidities. That this is the reason why we are talking about a holistic approach to neurological disorders and movement disorders. We know that diabetes is linked to dementia and to Parkinson's disease, depression, bipolar disorders, hypertension, because also the vascular blood system in the brain, it can be inflamed. And also the inflammation is one of the factors that they contribute to some neurodegenerative disorders. So if you reduce all these factors, you can go in the prevention also for Parkinson's disease and stroke and Alzheimer.
Yeah, absolutely.
Ana Vojnović-Zorman, RTV Slovenija. One of the most important things, as I was told, I hope you agree, is also the early diagnosis. The earlier we diagnose the illness, the better we can cure it. And in Slovenia, there is a problem that on the primary level, a lot of doctors, they do not send patients to neurologists. They are not equipped with the knowledge to do it in the early phase. That's what I was told. So are we doing anything in this field? And what can a patient do if he suspects it's with all the neurological diseases, there's one more thing, and it's like shame or
stigma.
I don't want to, I'm living in a denial. I don't have this disease like Alzheimer or Parkinson. So people come to neurologists in like late state. and not early enough. So do you see this as a problem, and how are we doing anything about it? Thank you.
Thank you for this question, but luckily I shall not agree with that, because maybe Professor Kovač and I, we are regularly doing movement disorder clinic, and patients with Parkinson's disease come to us rather early. So I don't think it's a problem that patient... Maybe he noticed this problem in some maybe regional areas of Slovenia, but in general, okay, it's true that we are working in the center of Ljubljana, and probably maybe the people are more educated, but the people come from all parts of Slovenia. So from my clinical point of view, it's not a big problem. Of course, the education at the medical faculty could always be better, but I think we pay a lot of attention to the movement disorder topic in our medical school. We have other challenges, maybe when to recognize the advanced stage, when patients are ready for device-aided therapies. That's a challenge on the level of neurology, but we are trying hard to educate. But luckily, I don't think so. I mean, similarly, in the cognitive outpatient clinics, we have much more patients who come to us in really early stage with mild cognitive impairment, subjective cognitive impairment, not when they are already moderately demented. So I think the public knowledge is improving, and patients do come to the neurologist if there is a need. So luckily, I don't think that's a real problem.
Maybe I can just, I think there are two separate issues probably here. The first thing is, unfortunately, we don't have a cure. So even though you may diagnose the patient early, for example, there isn't any disease-modifying treatment we have at the moment. But we are hopeful that there would be in the future. So therefore, early diagnosis or even prodromal, even before they have developed the full disease, those people are extremely important from a research perspective. In England, the diagnosis can be suspected by the primary physician, but for the formal diagnosis, they have to be referred to a secondary or a specialist center. So the diagnosis is only made by somebody like Maya or Maya Kuchvik or somebody other. So from that perspective, sometimes it takes a little bit of time for them to reach the specialist center. But generally, I would agree that there isn't a delay in making a diagnosis. People have become quite good at recognizing this, but we don't have disease-modifying treatment. So I don't think that if somebody had waited, maybe had a bit of tremor and waited 3 months, that their disease would have been affected from a perspective that we didn't give them treatment early. Okay, so I think that hopefully in the future, if we have disease-modifying or cures, then that would become very important to catch them right, when they have the most minimum signs.
I may add, I would agree that here in Slovenia there is no such a delay in diagnosis, but maybe the confusion is that Parkinson's disease is diagnosed when clinical symptoms appear, so tremor, stiffness, and slowness. The disease process starts many years earlier, and this is the stage of so-called non-motor symptoms, and these are quite unspecific, like obstipation, loss of smell, or problems with sleeping. It's very difficult, if not impossible, to clinically diagnose disease in this stage, very early stage. And however, it will probably becomes more important once we will have treatment to secondary prevention, so to slow down or to stop that process. But I think also that is it all, the reason of such a maybe a long waiting time in movement disorders clinic is that what Professor Kailash Bhatia said, like the general practitioner will always refer a patient to the neurologist when he suspects Parkinson's disease.
Can I just ask one, maybe last question, because we are very late, I think. So one, with prodromal symptoms like very vivid dreams, when you see things twice, but only once get meant, like in matrix, medicine. And maybe a neurologist can say, yes, you are prodromal phases. What can we do in that time? Just leave the patient to have some other symptoms like tremor, or can we give him some drug?
Yes, I think we
Time for secondary prevention, yes?
walk.
30 minutes, 30 minutes, 3 times a week, yeah.
20,000 steps.
So, as we were saying, we don't have any disease-modifying drug at the moment.
Yeah.
So, the only thing you can do is improve your physical state, like Elena said. You know, if you got diabetes, you got anything else, you make sure that you control them. Make sure you exercise.
You can't sleep.
Yeah, better sleep.
You can't sleep.
All of those
Also,
things.
You have vivid dreams. You are terrified sometimes. You have dreams.
So those vivid dreams actually don't cause any harm, and the patient usually doesn't even know them.
You don't know what kind of those dreams.
They can be dangerous. You can fall down
From the bed.
Very rare.
Well, there is a medication, so we can give a medicine for this sort of if there is a need. But yes, we can recommend exercise, eating well, and avoid risk behaviors. To exercise, eat well, avoid risky behaviors. So yes.
And also there are some clinical trials, right, with new drugs, the antibodies against the alpha-synuclein, which are addressing some of the very early people. So these are population usually they are followed by specialists, and when there is a minimal signs, they can be also enrolled in clinical trials. But also, as we said, the gut is very linked to the brain, so we have to treat our intestine very well as well.
Thank you very much.
So the well of challenges and questions that will require answers is endless. However, our time for the press conference has run up. So I would like to thank our guests, the organizers, for the opportunity to begin talking about these topics, and I am looking forward to many future opportunities. And I thank you for the interest. Thank you. See you again. Yes.